One career area that's fairly immune to the economy's ups and downs is healthcare. While many healthcare professions require extensive education and training, that's not the case with our next career, patient advocate or care manager. As Jeff Yasteen reports, people who choose this field have many different possibilities.
Olga Bruner is one type of patient advocate. She's a geriatric care manager.
Joanne.
Her job is to look after the needs of aging clients like Joanne Valentine. Valentine lives by herself. Her husband died nearly a decade ago. She's healthy and active and not interested in living in a nursing home. Her adult children who live out of state hired Bruner to oversee their mother's care. That includes not just visits by day nurses, but taking Valentine to health-related appointments, sitting in on talks with doctors, and helping her navigate the paper maze of prescriptions, bills, and Medicare rules.
Family members, love that we're here, and while they don't have to leave where they're living to fly down and get here, from month to month to see, what's the new problem this month? They can rely on us.
Besides geriatric care managers, the emerging profession of patient advocates includes other categories. Patient representatives generally work for hospitals, explaining in-house procedures and policies, listening to complaints, and solving problems regarding medical treatment. Independent patient advocates are hired by patients themselves, usually on an hourly basis. They help resolve coverage issues, billing errors, and other conflicts with insurance companies, hospitals, and providers. Kevin Flynn runs healthcareadvocates.com.
What an advocate does is their job is to work today's healthcare system, making sure that you maximize your benefits, you maximize your outcomes, and you reduce your out-of-pocket costs. They're there to protect you both medically and financially. And also they're there to help you ease through the situation you're in.
So how does someone pursue a career as a patient advocate? Most who work in the field already have professional experience and are trained in other healthcare areas like nursing or administration. Some, like Flynn, learned how to navigate the healthcare system from the inside out as former patients. Getting into the field is fairly easy. Almost anyone can call himself or herself a generic patient advocate. There are no real licensing requirements or professional certifications. However, becoming a geriatric care manager, or GCM, requires a certification overseen by a professional peer organization. Among the few academic programs in this field, the University of Miami offers an online healthcare advocacy certificate. School executive Marcy Ullum says it's gaining traction.
We get between 5 and 10 inquiries a day. We've been very pleased. Having been in this business a long time and seeing a whole lot of startup programs, this has taken off in terms of inquiries and interest rapidly.
As far as job growth goes, consider this. The number of Americans aged 65 years and older will grow by more than 50% over the next decade. Those people will need increased medical care. And because the U.S. healthcare system is likely to get only more complex with or without healthcare reform, there's little doubt about the need for more patient advocates. Jeff Yasteen, Nightly Business Report, Miami.
Following up on Jeff Yasteen's last point, I asked Marty Nemko what kind of impact could changes in the healthcare system have on patient advocates?
Any changes are going to lead to more complications because any of the standard practices that a person may have had in trying to get his health care covered, it may change a lot under the new system. But even without any changes, there's simply the difficulty of getting a diagnosis, who you're going to see for a second opinion, how are you going to prepare for a hospital stay, how should you prepare for your doctor's visits, how should you interpret the bills. There is an enormous need for patient advocates.
Marty, we know that this whole area of healthcare is going to be a top growth field for careers, but why do you think being a patient advocate is the best specialty area among healthcare professionals?
Everybody knows there's going to be a need for more nurse practitioners, physician assistants, etc. But most people never even heard of patient advocate, so it's under the radar. The competition may be less rigorous. Also, just from a personal emotional standpoint, thank God I'm healthy, but if I wasn't, I would be scared to death. Boy, would I want to have a patient advocate who can help me wend my way through that disease diagnosis, treatments, and paying for it. So that's why.
How do you train to be a patient advocate?
Well, people tend to come from it from one of three fields. They're either former lawyers, former nurses, or former social workers. But there is no, at this point, there's no certification. Like most fields, as they mature, they tend to be, there's going to be professional associations, and there is going to be a certification process. But for right now, if I were to advise somebody on how to get the best training, first of all, ask yourself in your heart of hearts, are you one of those people who's got the drive to be able to work your way through a bureaucracy? Are you not afraid to call 3 or 4 times that doctor's office to make sure you get that appointment soon? Are you not afraid to go and dig up a lot of internet research? Are you not afraid to go to Medicare and say, how could you not cover that? So some of it is the personality, the temperament, and the intellectual firepower to do it. But some of it also is knowledge of the healthcare system, and that's why either being a nurse or a medical social worker is a great entree point.
So is this career good for somebody who likes to work on their own, likes to run their own business, or are there also situations where you can be a patient advocate and you can be getting a straight salary?
If you've got the self-employment kind of that magical gift, it may be most ethical to work from that perspective. That said, certainly if you want a salary, there will be hospital jobs for people who are going to help as patient advocates, if you will, patient representatives. And also, I believe that in healthcare reform, the government is going to be hiring more people to be ombudspersons. They'll call them different names. They may not call them patient advocate. They could call them something like ombudsperson or patient representative, but there will be salary jobs.
You touched on this before, Marty, but can you also just go through again the type of person who should go into a field of being a patient advocate? What does it take?
In a word, it's a crusader. Somebody who is going to have the zeal to go after talking to the hospital to make sure that the treatment is administered quickly, to fight for something getting covered, for tenaciously doing the internet research, to not just look on 1 or 2 websites, but to find everything there is to know about that disease so the patient is armed. Knowledge is power.